Hello, this is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. I'm excited today to be at our CGH Dixon Clinic. We're going to take an opportunity today to walk around and get a chance to see what services we have here, meet some of our providers and staff, and just give you an overall view of this Dixon Clinic here that we have at CGH. As a point of reference, our clinic here in Dixon is located in the mall where the Culver's is at in Dixon, for those of you who are fast food folks who like to know where those things are at. So that's where we're at, back behind Culver's. Okay, so the first stop I wanted to have an opportunity for you to see is our Ready Care here at the Dixon Clinic. And Ready Care is you just walk in the door and Ready Care is on your left. And I have Kayla here with me. Hi, Kayla.
Hi.
Kayla works at the front desk, and so when you come in, you're going to see Kayla's smiling face. What time is Ready Care open, Kayla?
Ready Care opens at 8 o'clock.
And what time is it open until?
8 to 8. So Monday through Friday, we're open 8 to 8. Saturday and Sunday, we are open 8 to 1:30.
Great. Yeah, and so we were just talking before we went on the air that we get a lot of compliments from patients who come through our Ready Care. What's some of the feedback that you hear, Kayla?
They are really appreciative that we are located in Dixon, so they do not have to drive to Sterling. They think it's a good addition to the community in Dixon, Amboy, Savannah, just everywhere.
Well, we're pulling from Savannah too.
We are. We do. We see a lot of people.
Okay, so if you're in Savannah, keep us in mind over here in the Dixon Ready.
We do.
Yeah.
We got a lot.
All right. So anyhow, we're going to go back now and go and see the inner workings of the Ready Care Clinic. Kayla, thank you for taking the time to chat with me.
You're welcome.
So we are now back in the bowels of Ready Care. And I have with me Maggie, one of our nurses in Ready Care. Hi, Maggie.
Hi.
Maggie is so excited to get a chance to join me, aren't you, Maggie?
Yes.
Yeah. I just wanted to take a moment to chat with Maggie about what were some of the things that we do here at Ready Care, and in particular, the sports physicals that we're doing this summer into the school year. So tell us a little bit about that, Maggie. How does that work for patients?
So patients can just walk in to get their sports physical for all of the surrounding areas for $25. So we are open from 8 to 8. It's just a walk-in basis. Probably takes about 10-15 minutes to get the sports physical done, and then you're on your way. So it's in and out, and it's really convenient, and only $25.
And if I remember right, I think $5 of that actually gets donated back to the school of wherever that child is attending. So that's kind of a nice thing we thought we would do this year as well.
Yes.
So, on a side note, Maggie, how long have you worked here at the Ready Care since it opened up?
No, I've only been here since March.
Okay, all right. How's it been working here in Ready Care?
It's good. I get to do a lot of different things. Sutures, a lot of shots. We've had quite a few sprains and breaks, so we get to do splinting. We splint the patient before they were to see an ortho.
Very good. All right. Well, Maggie, hey, thanks for your time.
You're
I'll
welcome.
let you get back to work.
Okay.
All right,
thank you.
So now I am with one of our nurse practitioners, Desi Burke. Hi, Desi.
Hi, Dr. Bird.
Desi works here in Ready Care and does a really good job. She actually was in our ED for a number of years.
Yeah, I was a nurse in the emergency department for about 9 years, and then I was a nurse practitioner in the emergency department for about 1.5 years before we opened up here.
Yeah. So Desi has some of that ED experience that she brings here to Ready Care. And I thought maybe I'd ask her a little bit about that, Desi. So what are some things that patients can come here for that they don't have to go to the ED?
Well, obviously, any type of colds and coughs where if you're not having any shortness of breath or severe shortness of breath, we obviously take care of colds, coughs, sinus issues. In the summertime, we don't get quite as much of that stuff, but we do like minor falls. So if you've got like a little laceration or, you hurt your knee or your ankle, we do have x-ray capability here. So we can evaluate some of that. Sometimes, some of your minor sports injuries. And then Allergies is a big one right now.
I'll
There's
bet.
a lot
Yeah.
of allergies going around.
Sure.
Another thing too right now that we're seeing a lot of is a lot of poison ivy, poison oak, all those nice rashes. Everybody's out doing their gardening
Right,
and things
right.
like that.
Right.
So we do that. You know, other things that you could, you know, call, see your primary for. Anybody's able to walk in for those acute illnesses such as like urinary symptoms. If they're minor, you're not having fevers or like vomiting, but you think you might have a little urinary tract infection or something like that. We also evaluate people for those illnesses as well.
Yeah, good. That's helpful. And then the other thing our marketing folks have mentioned too is that on our website, there's some information about like how to decide whether your condition is a good fit for Ready Care versus going to our emergency department.
Yep. So that's all located online too. And you can call and talk to our nurses too. If you have any questions about different services that we offer, our nurses are here to answer those questions as well.
Yeah. And I've already said it when we doing this interview up front with talking to Kayla, but we've had really good feedback. All the time we get compliments on Desi and all the folks that work here in Ready Care. So I know you'll have a really good experience if you come to see Desi. And we're standing right now in the
This is our procedure room. Sometimes we do procedures in here. Sometimes, depending on what it is, we'll do it just in the patient's room. So if you need a splint, if you come in and you have a small fracture, you know, we'll come in here, we'll put a temporary cast on. We've got our crutches over in the corner. Sometimes you'll just need like maybe a boot, which we have those too. And then we get you linked up with either orthopedics or with podiatry, depending on where that's at. And we also do some of our laceration care, depending on how big the lacerations are.
Sure.
We also do incision and drainage.
Yeah, so if you have like an abscess, that they can help you out with that. One of the things you told me before we did this interview is that like if someone's on like a blood thinner, you can do a little work to help them with that too.
Yeah, so many people that are on blood thinners, you know, Eliquis, Coumadin, things like that. If you get a small little laceration, those people know sometimes it is really hard to get that bleeding to stop. And if it's small, you know, obviously if it's something very large and you're on a blood thinner, that would be something more likely that you would need to see the emergency department for. But if you're having a hard time getting that bleeding to stop, we do have some different things here that we can put on the laceration or the puncture wound or whatever it might be that kind of help with that clotting superficially to help get that bleeding under control. So we do see people for that too. Yeah.
And the other thing that you do that I like that we're able to do for some patients is you glue lacerations too.
Yeah. Depending on the location. So those kind of areas that don't have a ton of movement, you know, a lot of times like kids will fall and get a little lack on their head or just right on their eyebrow. Those are a little bit better for the glue. So we would evaluate you, and if we think glue is a good option, we would do glue at that time.
Yeah,
So,
good. One of the things I wanted to ask you about, Desi, was just for the patients who are showing up to Ready Care, number one, do you have to be a CGH patient? Number two, do we have any insurance restrictions? And number three, if you show up and you need some sort of follow-up with a primary care doc, how do you all get them plugged in?
So you do not have to be a patient or established with CGH already. Anybody's welcome. We do accept all insurances, including Medicaid. And then if you don't have a primary doctor that you see regularly, we do have several accepting primary care providers that we can get you linked up with for follow-up care after you see us.
Yeah, good to know.
Yeah.
Okay, I just want folks to hear that because sometimes when you think of CGH and Ready Care, you might think that it is not restrictive to CGH patients. Want folks to know that. And that's the same for our Ready Care in Sterling, just so everyone is aware of that. All right, well, Desi, thank you for your time.
No problem.
Great to have you here in Ready Care. And I'm going to move on to the next stop in our Dixon tour.
All right, thank you.
Thanks, Desi.
Yep.
I am in our X-ray department here at our CGH Dixon Clinic, and I have with me Charity. Hi, Charity.
Hi.
Charity's been an X-ray tech here for quite a number of years.
15.
Okay, yeah. So she knows her way around X-rays. I just wanted to give you a minute, Charity, just to kind of talk about what X-rays and services that we provide here in the Dixon Clinic.
Yeah, so we see all of the internal patients from rheumatology, family medicine, dermatology, and then we see all of the ready care patients, but we also accept outpatient
that's right, yeah.
orders
Yeah,
from any outlying doctors in the area.
Yeah, so there's a lot of activity here with in the X-ray room, in that we have multiple specialties that use you here in the Dixon Clinic, and then some outlying areas, like if a patient's in Polo or someone like that, they may end up here at your to say hi, right?
Yeah.
Okay, and in terms of X-rays that we do here, I assume it's extremities, chest, anything else?
Spines, any type of X-rays. We just don't do CTs here, MRIs, or ultrasound.
Yeah, which having Charity here and the rest of the X-ray techs has been really helpful, particularly for our Ready Care. So if you come to Ready Care, we already talked about that with Desi. It's so nice to be able to have, if you have a wrist that you sprained, to have Charity be able to just take a quick X-ray and take a look at that and see if in fact there's an issue or not.
Yep, and we use all digital equipment, so the imaging is really well, and then everything gets read by our radiologist within 20 minutes.
Yeah, great point, and that's awesome. So yeah, because it's digital, we can just send it over, and our radiologists take a look at it and give our Ready Care providers information about what's going on with that X-ray. So, Charity, thanks for your time. Appreciate it.
Thank you.
Our next stop on our Dixon tour is in our lab, and I have with me in our lab Brenda. Hi, Brenda.
Yes, hi, Dr. Bird. How are you?
Good. I'm doing great. Thanks for taking the time. Well, I kind of made you take the time to hang out with me here, but
that's okay.
How long have you worked in the lab?
I've worked here for 5 years.
Okay. All right. So you've done a lot of lab draws in the last 5 years. Yeah. Tell me about the lab services that we offer here in Dixon.
So we offer limited service, but we do every outpatient, including the main clinic. But we do COVIDs, we do CBCs, and we do urines.
Okay. So, and then in terms of Ready Care, I'm assuming you do some wave tests too, right?
Yes.
So, like if someone comes to Ready Care, what are some typical labs that they're going to be asking you to do, Brenda?
It's mostly urines and COVIDs.
Okay.
COVIDs and streps.
Okay. And if I remember right, like during the heat of the respiratory season, I think we actually run that fourplex, which is COVID.
The COVID, flu, both flus, flu A and flu B, and RSV.
Yeah.
Yes.
Okay. So we have that capability here as well. But what I'm hearing is that also we do a lot of lab draws here for patients that are either coming to this clinic or somewhere in this area, and then we can send those labs over to the mothership in Sterling.
Yes. Yes. And we also accept outpatients. So if you have a order from Northwestern, we also accept you guys. Any lab draw. We're here.
All right. Brenda, hey, thanks for your time. I appreciate it.
No, thank you.
Okay, well, our next stop on our Dixon Clinic tour is a stop we have to make to see a Dixon institution, Dr. Eric Gale. Hi, Dr. Gale.
Hey, Bill.
Yeah, good to see you.
Welcome.
So Dr. Gale has been here for a while. How long have you been in the Dixon Clinic, taking care of patients?
In July, it will be 32 years that we moved here.
Yeah, so he knows a few
Started
things.
August 1st, moved July.
A Dixon institution, like I said. So glad to get a chance to talk to Dr. Gale. And Dr. Gale is still actively practicing seeing patients. As a matter of fact, I was chatting with your staff before we went on air, and they said, Dr. Gale loves babies. So I think you're still taking on.
We like to get the new kids and babies in here.
Yeah, so he's still taking on new babies here at his clinic. And Dr. Gale, anything else about your clinic that folks would want to know in particular?
I'll bring in all the kids anytime.
If you're getting a theme here.
We focus on getting people in really quick when the kids are sick.
Yeah, I know you do a really good job
There's
of
no
that.
waiting till a week or 2 or 3 for an appointment when people are sick. We get them in quick.
Yeah. Dr.
That's
Gale.
because of Trish, partly.
Dr. Gale is pointing to his nurse who's behind our camera, but yes. So anyhow, I wanted to make sure we get a chance to talk to Dr. Gale. And one of the things I wanted to ask you too was, things have changed a little bit in terms of now you have a partner that helps you out and also have a nurse practitioner that helps you out. Do you want to talk a little bit about those relatively new developments?
we just work together. And nurse practitioner Marissa and I, we back each other up. Anytime I'm not here, she's here. Anytime she's not here, I'm here. Most days, we're both here. And then we have a new family doctor right down the hall, too.
Dr. Alanis, right? Okay. Yeah, so Dr. Alanis is available. So most days of the week, I think we have it covered in terms of someone here to take care of folks.
There's almost always at least 2 providers.
Yeah, so that's been a nice upgrade because for a while you were trying to make it go of it alone, and that's pretty tough.
It's nice having more.
Yeah.
And the whole office is busier, so that's good.
Yeah, and just for clarification, Dr. Gale is a med peds doctor, and I'll let you just briefly, before I let you go, kind of talk to the folks about what that means.
Well, I have a pediatric residency and an internal medicine, which is a doctor for adults residency, combined into one residency for 4 years rather than 3.
Yeah. So that's
both.
So part of your emphasis when you say you really like kids is you've done a pediatrics residency.
I'm an echo pediatrician.
Yeah. So, all right. Well, I'm glad we got a chance to catch up with you, Dr. Gale, and thanks for all the work you've done here in Dixon throughout the years and that you're currently doing.
Thank you.
Yep. Appreciate it.
Thank you.
Our next stop in our Dixon tour site visit, is to see Rachel Dietz. Rachel is one of our PAs in dermatology. Welcome, Rachel.
Thank you.
Thanks for taking the time to chat with me. I know you're pretty busy today.
Yeah, no problem.
I just wanted to ask so folks kind of have a sense of the services that you provide in dermatology here at the Dixon Clinic.
Sure. Yeah, we provide a few different services, of course. We see medical dermatology, which includes skin checks, skin cancer checks, mole checks, other forms of medical dermatology like acne, warts. We see all ages, pediatrics, all the way up to elderly patients, so pretty much the whole gamut.
Yeah, and Rachel, you've been doing this. I don't want to use.
15 years.
Yeah, I was going to say you're experienced.
Thank you. Yes. I've been here now 15
Nicely
years.
experienced.
Yeah,
yes.
Thank you. Yes.
So you've been there, done that, seen a lot of the stuff that folks would come in with.
Yeah, I feel like, and Mark too. Mark's our other PA over in Sterling. We've both been here for a really long time. We take care of a lot of patients, and yeah, it's a great time.
Yeah. Well, hey, thanks, Rachel. I know Rachel's in the middle of a busy clinic, but I wanted to catch her just so folks get a chance to see her and know what services we provide. So,
Absolutely. Thank you.
Thanks, Rachel.
Sure.
Well, my next stop is in our rehab department here in the Dixon Clinic, and I have with me Mary Alice. Hi, Mary Alice.
Hello.
I know Mary Alice looks very young, but I knew her when she was even younger, right?
Yeah, maybe.
I think you started here when you were were you in high school?
Yeah, I think I was like 18 or 19.
Yeah,
It can't have been. Maybe I was a little older than that, but
yeah.
still
So
a
anyhow,
baby.
Mary
Still a
Alice was
baby.
with us in the rehab department and worked as a rehab tech, and then went to school. And now you're. Look at you. You're all grown up. She's a physical therapist. So one of the things I thought that would be nice is just to kind of come into this gym because it's a really cool setting for patients. And Mary Alice, I wanted you just to give a thumbnail sketch of what kind of services we provide for patients here in rehab in the Dixon Clinic.
Yeah, so we see most populations really anywhere between ages like 8 plus.
8 to 80, if you will,
yeah,
right?
8 to 80. We see really anything head to toe. Anything from vertigo, concussion, all the way down to the toes, fractures, balance, stroke patients, neuro, orthopedics, of course, any geriatric population is pretty big here. We also have specialties.
Yeah, what do you have? I'm curious about that.
Yeah, we have specialties in pelvic floor rehab, which is huge. We have dry needling. We offer, we have some neuro specialties here, specifically with the Parkinson's population.
Okay.
We offer big and loud.
So big and loud, just briefly, what's big and loud?
Yeah, that's particularly for our Parkinson's population. So we do big with PT. A lot of times Parkinson's patients tend to be forward and shuffle steps, so they take small steps. So big really is overemphasizing exaggerated motions and movement, and then loud is normally for on the speech end. Loud projecting.
Yeah, and I wanted to go back to one of the other specialties. You mentioned pelvic floor, so that would be like, give me an example of a problem that a patient would come to here for with that.
So the most common one is probably incontinence issues of any kind, like the stress or urge incontinence. Any leakage with, laughing, coughing, jumping, or any activities, to pregnancy, postpartum, any pelvic pain, pain with intimacy, pain with low back, really all of that is covered in pelvic floor.
Very good. And because we've done interviews in a Facebook Live with our women's health folks, with Pam and Morgan and Lindsay, but we also offer that service in addition to Sterling and Morrison. We offer it here in Dixon, so I wanted to highlight that too. So, hey, Mary Alice, I know you're busy with patients, but I appreciate you taking the time to chat and let everyone know about the services you provide here at the Dixon Clinic. And it's not just yourself, but you have...
Yes, there's Allison Loggins is here, and so is Dylan Harshman as well.
Yeah, so we have a nice staff that if you need to get in, we can find a way to get you in here to get taken care of. So thanks, Mary Alice, appreciate it.
Yeah, no problem, thank you.
Our next stop on our Dixon Tour Clinic field trip is with Dr. Ajay Buddharaju. Ajay, good to see you.
Good to see you again.
Dr. Buddharaju is our rheumatologist here at the Dixon Clinic. And I wanted to just take a moment of his time just to learn a little bit more about the services that he provides in rheumatology for patients. So if you just kind of let folks know some of the stuff that happens here at the Dixon Clinic for patients.
So I've been here with the CGH Medical Center for over 12 years now. And I spend 2 days in Sterling and 2 days in this clinic in Dixon. So we offer a multitude of rheumatological services, including arthritis, various forms of arthritis, inflammatory arthritis, gout, osteoarthritis. We treat soft tissue rheumatism like tendinitis, bursitis, and we do treat osteoporosis, and we treat various autoimmune disorders. Like lupus, rheumatoid arthritis and stuff, and we also treat vasculitis. And we offer infusion services in both Sterling and Dixon. And we also have a nurse practitioner that works with us.
I would guess in the last 12 years when you mentioned infusion services that has changed significantly in terms of the amount of patients that can benefit from those infusion services.
Absolutely. I mean, there is like a lot of new medications coming up, and that definitely over the years, we have a lot more options available for a number of these conditions. So definitely.
He's still a young man, but I knew him when he was but I knew him when he was a little bit younger. So Dr. Buddharaju, thanks for your time.
Pleasure, and welcome. And
if you need to get hold if you need to see Dr. Buddharaju, you just call our office and they'll work with getting you scheduled to see him. I know there's a bit of a wait because rheumatologists are not easy to come by, but once you get in to see him, you're going to like him.
Yes.
And one other thing I wanted to mention, you have a nurse practitioner that works with you too. So tell folks a little bit about that too.
Yeah, we had a nurse practitioner with us for at least 5-6 years now. Her name is Melissa Duncan. And she spends 3 days in Sterling and she spends 1 day in Dixon. We do see some patients together. So definitely.
So that's another option that we have here in rheumatology. So, okay, thank you very much.
Thank you.
Okay, our next stop on our tour of the Dixon Clinic is I was fortunate enough to run into Dr. Bob Pody. Hi, Bob.
Hello. Hi. How are you?
Yeah, I'm doing great. And Bob was actually on one of our Facebook Lives recently, so if you wanted to check that out, you could find that and we'll get more details about the work that he does here. But I just wanted to take a minute of your time, because I know you're seeing patients, just to kind of talk about some of the services that patients can receive here at the Vision Center in Dixon.
Sure. So I think the two most common procedures that we do here would be cataract surgery, We don't
Okay.
do that here, but we screen the patients for cataract surgery and do it over at CGH in Sterling.
Okay.
The second most common procedure would be intravitreal injections
Okay.
for a number of different retinal diseases, diabetic retinopathy,
Okay.
macular degeneration, vein
Okay.
occlusions. That's something we do right here in the procedure room down the end of the hallway.
Right. And I would say that's probably one of those retinal injections are probably one of those things that's still kind of a little bit of a well-kept secret here, in that we haven't had that service at CGH before. So Dr. Poti brings a different skill set for patients who need those services. You don't have to travel as far to have Dr. Poti do that.
Yeah, and that's something I've been doing a number of years. I was doing it in the year 2000, was just experimental. So for 25 years, I've
Yeah.
been doing it, and probably 10,000 or more patients. I mean, many, many patients.
Yeah, he knows how to do it. So yes. And then one other quick question. So if a patient wants to get in to see you, how do they go about doing that, Bob?
They could just call and make an appointment, and let the receptionist know what you're coming in for.
Yeah.
Or of course, the area optometrists and that refer patients or primary care patients get referred as well.
And speaking of optometrists, we have an optometrist here with you.
Yes, Dr. Ed Hanlon is across the hall, and he sees patients here as well.
Yeah. So for those non-ophthalmic, if you don't need a vision doctor, you need to see Dr. Hanlon. You get you set up with glasses and any sort of
Contacts, things like that.
Yeah, he's he's very helpful for that as well. So, Dr. Poti, thank you for your time. I appreciate it.
Oh, you're very welcome.
All right.
Good seeing you.
Good seeing you too, Bob. Okay, as Dr. Poti mentioned when I was chatting with him, we also have a really nice optical shop here at our Dixon Clinic. It's actually just right when you come in the front entrance and turn to your right. And I have Danielle with me, who has been here at the optical shop for a while, haven't you?
18 years I've been here in this department in this exact position.
Okay, so you've seen a lot of things, haven't you?
Yeah. A lot of patients have been with us for many years, and a lot of new patients still coming in, joining us.
Yeah. I thought I'd give Danielle the floor to talk about some of the services that you offer here at our optical shop, and matter of fact, before I can get into that, we were talking before we came on that this optical shop is an award-winning optical shop.
Yes, this and our Sterling location have both won the Reader's Choice Award the last 3 years in a row for favorite place to purchase eyeglasses. So that's pretty exciting.
Hey, sounds like this is a place to at least check out before you get your eyeglasses. So Danielle, talk a little bit about the services that you provide here for those folks who are looking to purchase eyeglasses.
So we can fill eyeglass prescriptions from outside doctors and our own physicians here that we have here in Sterling and Dixon, and we do free adjustments, free nose pad replacements, anything that we need, cleaning, things like that. So you can just walk in the door without an appointment and we can pretty much take care of what you need.
Yeah, I can vouch for that because I remember getting some glasses, and I'm more over in the Sterling area, but yeah, you pop in and they'll get you set up and troubleshoot for you and everything like that. So. Yeah. Okay. Anything else, Danielle, that the folks that are watching need to know about our optical shop? I wish they could see all the glass. This is really impressive. All the merchandise that you have here.
We get a lot of compliments on the selection that we have and the area and the space that we have for people to look and browse around, and people can come in and do that anytime.
Yeah. So anyhow, Danielle, thanks for your time and appreciate the work that you do here in our optical shop. So I think that concludes our tour of the CGH Dixon Clinic today. We've had an opportunity to talk with several of the providers and staff that work here at the Dixon Clinic, but I'm standing next to a sign that I also want to highlight, in that there were a number of providers that I wasn't able to have you see today, and so I wanted to highlight those before I finish. So as you can see next to me here, we have allergy, oncology, wound healing. I'm missing a couple. OBGYN. So if you're going to have a baby or have a gynecological problem. And sleep medicine are also specialties that we offer here in the Dixon Clinic. And those providers just weren't available for our visit today. But I wanted to make sure I highlighted those folks, because really the whole goal of the Dixon Clinic is to provide as many services as we possibly can to the folks of Dixon and the surrounding areas for the medical care that they need. So anyhow, I'm glad we had a chance to finish here with me standing next to this sign with all the other services that we offer. And as always, if you have an opportunity and find this helpful, please share this with others that you know. Until next time, this is Bill Bird, Chief Medical Officer at CGH Medical Center, signing off.